5 ways we grow practices at record levels. We're going to break those down into 5 separate categories tonight and give you away as much information as we possibly can. The first one is consumer expertise. We are consumer experts, and our goal is to make sure our clientele remains ahead of where the consumer is taking that particular profession. Right now, consumers are taking healthcare down a path that most healthcare professionals are not trained to provide. And again, it's not a criticism whatsoever, but again, it goes back to you guys being a commercial business that happens to have clinical operations going on within it. 90–95% of what you do is commercial. The clinical piece, you in the mouth, is a very small percentage of the practice. And again, it's not, I have great admiration for doctors, what you guys do. It's not to diminish anything whatsoever. It's just, again, to get your mindset in the right place of you guys are a commercial operation that happens to have clinical things going on in it. What would you guys say the answer to this question is? D, right? And I've never, in many years doing this, have never had anybody say anything but D. But because everybody says D, you just defined yourself as a B2C business. You're a business to consumer, a B2C business, which just puts you in the exact same category of any other company offering something to a consumer, whether it be a product, a service, whatever it may be, or a combination of everything above. A B2C business, which means you have to be an expert in consumers. If you're going to be a B2C business and you're going to close consumers on picking up the phone to call you, convert them over the phones, whatever it may be internally, you have to understand the consumer. CEO of Apple, this is a great quote, is basically just summarizing what he says there, is it doesn't matter what you think about your practice or your business. It doesn't matter what I think. I think we're great, but honestly, it doesn't mean one thing. All that matters is what the doctors are saying about us. Great guys like John, what he's saying about us, that's what matters. So it does not matter if you think you're the greatest thing on the planet if consumers are out saying something differently, okay? What biology tells us, this is some of my most passionate things that we do that I'm about to talk about. We're not going to have time to talk about all of them tonight. But there's a 3-step process that your brain goes through, Eric's brain goes through. How's your throat, by the way? Better over there? All right, good stuff.
Get all choked up around you guys.
Yeah. We all go through it. And the first thing is we have to understand what it is that's being presented to us. So if I present you, whatever, an Invisalign case, we'll use that as an example. However you articulate that to me, I have to understand why I need it. Otherwise, I don't get to part 2, which is valuing. And until you value it, your brain cannot move on to part 3, which is convincing itself that you can afford it, or maybe it's a referring decision, and you want a patient to refer. No matter what it is, your brain is going through that 3-step process, and it turns everything into images. Most of you probably know this already, but every single word that comes out of my mouth tonight is building an image inside your brain. Our brains turn things into images. They don't listen to words. That's not how brains work. Every single word paints a picture inside your mind of what it is that person's talking about. So the question then becomes, is what picture do your patients have of you? When you talk on the phone, the marketing you do, when you talk to them about treatment, what image are you building inside that consumer's mind? Because we're going to talk about it when we get to competition here in a little bit. Consumers can choose somebody else other than you, just like that question that we've had. And that somebody else doesn't have to be another orthodontic practice. It could be a GP practice that does Invisalign. Or it could be Best Buy to drop $4,000 on a flat screen TV if they understood, valued it, and convinced themselves they could afford it. Because you guys know what happens all the time. You hear, I don't know if I can afford that. Or I need to talk to my wife or my husband. You hear it all the time. And some of it may be valid, but any time that happens, you've missed those 3 steps somewhere. Because those consumers, not all of them, but a lot of them, guess what they're doing? That same night, they're going with the family to buy a flat screen TV or wheels for their car. And again, because they understand why they need them, therefore they're able to value it at a higher level, which convinces themselves that they can afford it. And we've all done it at some point in our lives. You bought something where inside your mind you wanted it so bad that you're like, well, if I move this bill here and I do this here, all of a sudden it's going to open up this little bit of room and now I can buy it. We've all done it at some point. And that's because this 3-step process is happening. How you doing, sir?
Good.
How's it going?
Good.
So there's the 3 right there. You got to understand it. You cannot value anything. unless you first understand it. And then the next step is you're able to value it, and then your brain will convince itself it can afford it, or to refer if that's what you're asking, which is a great way to increase referrals, which we're going to talk about. Now, and you guys tonight, because it's a small group, if you guys have questions while we're going, just interrupt me, and we'll stop and just start talking about that one topic, okay? So don't be afraid to raise a hand or just jump in, okay? So any questions so far about what we just went over? Pretty straightforward? Okay.